This PetX Talk is brought to you by Natura Pets, Found Animals, and Dogwise Publishing.
Hi, I'm Dr. Rob Silver. I'm an integrative veterinarian in Boulder, Colorado, and have been for 35 years. Practicing in Colorado during the time period when they legalized medical marijuana has given me a lot of hands-on experience in the use of marijuana, cannabis, and hemp for pets problems. And that's what I want to share with you today. The title of my talk is Medical Cannabis, How to Use It for Your Pet. And what I need to tell you, first off the bat, is that dogs are not just little people. Dogs have their own unique anatomy. And one part of that anatomy that we have discovered through research studies is that dogs have a heavier concentration of what we call CB1 or THC receptors that are in the hindbrain, the part of the brain that governs balance and respiration and heart rate. And even though we know, popularly speaking, that no human being has ever died from too much marijuana, we actually have documentation that some dogs have died from a THC overdose, having gotten too much. Now, perhaps they were also taking in chocolate, which is toxic to dogs. I heard one story about a little 8-pound dog that ate an 8x8 tray of pot brownies, had a whole ounce in it, and this dog died. So this is what I want to explain to you, that the use of THC in dogs can be difficult and possibly could lead to a trip to the ER. There are ways of introducing THC to the dog that would not create these problems. That takes a little more time and a little more depth to get into. But it's for that reason that I feel that it's everything else in the cannabis plant, the CBD, the cannabinoids, the terpenes, the flavonoids, all of which have medical benefit but don't have the downsides, the potential downsides that THC can have, are more applicable for use in our pets. This is why I suggest and endorse the initial use of CBDs, primarily cannabinoids that are derived from the hemp plant, which legally has a very, very low non-psychotropic THC level. If you are going to use THC in your dog, you need to start with an eensy-teensy-weensy little dosage to begin with, and one that's non-psychotropic and doesn't have any effect at all. And you need to give that for at least a week in order for them to develop tolerance. And then you can start to very slowly creep that dosage of THC up in order to make sure that they don't develop loopiness, they don't get high, dogs don't like to get high, or that they don't develop this neurologic syndrome that only dogs get with THC called static ataxia. Let me give you an impression of a dog who's had too much THC. What they do is they stand base wide on all fours and they kind of rock back and forward like they can't really move, because they can't, because the THC has basically paralyzed their ability to maintain their balance. They might drool a little bit as well. That's a problem if they have this. And the best way is to avoid giving them too much THC, and the best way to avoid doing that is to look to hemp products for pets initially, because they're safer. So when we look at using medical cannabis for pets, we want to have an analysis of the plant so we know how much THC it contains and how much CBD it contains. Nature is really very wonderful because it's put these two compounds together in the same plant. And what we know is that CBD tames THC. It tempers the THC. So when we look at a plant, we want to find a plant that has a ratio that's been analyzed to give us a ratio between the THC content and the CBD content. Or you're looking at a product in a dispensary. You want to look at what the THC to CBD content is. You also would want to know how many milligrams of THC or CBD are present per capsule, per liquid unit, whatever the unit is. And certainly if you're getting something from a dispensary, be careful, because a lot of those edibles contain substances that either aren't good for dogs and cats or could be toxic, such as chocolate, raisins, or macadamia nuts. If we have a high ratio of CBD and low ratio of THC, that could be hemp. It's not psychotropic, but you have all the medical benefits of THC. And this type of ratio of high CBD, low THC, we like to use this for conditions of anxiety, for pain, for arthritis. Even some seizures can respond well to this. We could use this for diabetes, and we can also use this to treat certain types of cancers. I've seen a few types of cancers respond to hemp alone, no THC, where the tumors have gotten very, very small and have been under control as long as the animal continues to take the CBD. But I'm commonly asked, but don't you need THC to activate the CBD? This is not true. I've seen cases where we've used 0 THC in a product with CBD, and we've gotten very, very good results. I think this is an urban myth. Quite frankly, I think this comes from California, where they have a love affair with THC. But no, you don't need to have THC in your cannabis in order for it to work. And that's why hemp, medical hemp, can work really well. And that's why we're seeing such a huge upsurge of interest in products that come from hemp for pets. So high CBD, low THC, chronic pain, anxiety, arthritis, appetite, some types of cancers, diabetes, and some types of epilepsy. If your dog has seizures and you've been to the vet and they give you medication for it, and the seizures are so strong that even these really strong drugs aren't sufficient to stop the seizures, we don't get as good success using CBD with dogs that have this problem. Not that we shouldn't try, because I have seen some dogs that are on multiple anticonvulsants still having seizures that will respond well to the CBD. Perhaps their seizures will stop completely. If not, it might be that the period of time between seizures gets longer and longer, or it might be that the seizures themselves are less severe. So it's worth a try. But we have a dosing range that we use for CBDs, and I've established this with various specialists and in hundreds of animals. And what we have found that the low range of the dosage for CBD is 1/10 of a milligram for every kilogram. A kilogram is 2.2 pounds. So that comes out to basically 5/100ths of a milligram per pound twice daily of CBD is the low end. And the low end dosing of CBD works better for conditions like anxiety and mild pain. But the high end of the dosage for CBD would be 5 times higher, or 1/4 of a milligram per pound of body weight twice daily. This, we have seen some tumors go away. This, we have seen some seizures extinguish or be resolved. So that's commonly the high end of the dosage that we use. But I've been working with some neurologists who have been using substantially higher dosages than that, and we're still not sure if the higher dosages are working well enough, but I think it's worth a try if you've started at the low dose and that's not working. So we're using dosages of like 1/2 milligram per pound, as high as 1.5 milligrams per pound twice daily. Those are pretty high doses and can be quite costly. Safe to do, it's not going to hurt your pet to try those high dosages, and hopefully if the lower dose doesn't work, the higher dose might work. But when we go back to ratios, these were all about the high CBD, low THC ratio products. But we also can see at the dispensary products that contain an equal amount of THC and CBD. This is commonly used to treat cancer because the higher THC with the higher CBD is what does it. But in some cases, with some types of very aggressive tumors, we look at an even higher dosage of THC, 4 times as much THC as there is CBD in them. Obviously, because of the potential for THC toxicity, these higher ratios of THC should really only be used with some professional consultation, because you have to be very careful to not give too much THC too soon to create an adverse reaction that might send your pet to the emergency room. So the high THC, low CBD, we use it with certain types of cancer, severe pain. CBD is good for appetite, but so is THC. So in some cases, if the CBD isn't adequate to improve appetite, we could add the THC to that, and we might see an improvement in appetite. There are some legal considerations that people ask me about. And right now, in the United States, federally, marijuana is illegal. Doesn't matter where you are, it's illegal. At the state level, there's 29 states now that have passed laws that allow medical marijuana to be recommended by human doctors for their patients. And they then can take that recommendation and go to a dispensary where they can pick up the medicine that they need for their problems. In some states, there's 8 states, we have recreational marijuana. California is the latest to join this group. In recreational marijuana, they're basically like liquor stores. If you have a ID that says you're 21 years of age, you can go in, you don't have a medical condition, you can buy whatever you want. So that makes access easier without needing that medical card, but oftentimes in the recreational marijuana realm, they have very, very high THC products because recreationally, that's what people want. They want that THC. So buyer beware. Find out what is in that product that you buy and be aware of how much of it you're giving to your pet. When you do that, make sure you know what the dosage is. Give it according to the dosages that I've recommended. But an important thing to know is that the law in each state allows human physicians to make recommendations for their human patients. There is not a single law in a single state that allows a veterinarian to make that recommendation. And so for that reason, many veterinarians are reluctant to discuss it or talk about it in their practices. I think this is wrong. I understand that the veterinarians don't want to expose themselves to risk, but I think it's wrong that our legislature hasn't passed laws that also allows these benefits of medical marijuana to be given to our pets, our 4-legged family members as well. And I ask you as a citizen to work democratically within your state to get your state legislature to pass laws, to amend the laws that they've already passed to allow veterinarians to do this as well, because that will change everything. That will make this medicine much more accessible to pets in a safe and effective way. So in closing, I just wanted to thank you for spending some time with me today for the sake of your pets. And this is good information. Please be careful with your THC. But if you use my guidelines, I think that you'll find a great deal of effectiveness to it. Always, as a rule, start low. Start with a low dose and gradually introduce that over time. You might get very good benefits at the low dose. So, have a great day.
So we just finished the second part of your talk on the uses for medical marijuana in the pet world and opened up my eyes to a lot of different things. But my big question I have for you is, there's 29 states that this could be possible to help your pet, but what about the rest of the country? How can they benefit from this?
Well, it's difficult because right now marijuana is federally illegal. However, hemp is federally legal. It was passed in 2013 by the feds in the Farm Bill. And so that's why there's now 31 states in the union that are growing hemp, that it's legal to grow hemp. And theoretically, this hemp that's grown in one state, let's say Colorado or Kentucky, can be shipped anywhere in the United States. So for pet owners that are looking to get a source of some cannabinoids for therapy for their pets, I would say don't look for medical marijuana unless you happen to be in one of those states. And based on what I've said in all of my conversations so far with the audience, really you're better off avoiding medical marijuana with the higher THC in your pets because they don't really have a need for it and they have the potential to have adverse side effects. So I know that in some states they might have CBD products for sale even in grocery stores or in pharmacies, but probably the most reliable place to get it, no matter where you are, would be on the internet. And there's a number of internet sources for it. Now, the internet is a great place, but it also can be not that reliable as far as the quality control. So the consumer needs to investigate, what is the quality of this product that they're getting? What assurances can the manufacturer give them that what is on the label is really in the bottle and that there's no pesticides or heavy metals or other contaminants in it, like let's say mold growth or things like that. So, but it can be found on the internet and they can purchase it that way, although buyer beware. You may not be getting what you think you are.
So for those people in the States that might have to try to find different resources, what are some of the things they can maybe do to maybe make that change happen in their state?
That's a good question, and I think that this is something that the state legislatures have passed over in terms of being aware that the veterinarians and the pet owners, the pet parents in each state also need access to the resource of cannabinoid therapy, whether it's through hemp or through medical marijuana. So you can, as an individual, reach out to your local state legislature and write them a letter. Letters work. Give them a call. Phone calls work. Get together with your local pet group and as a group get together and write letters. And ask them if they couldn't please make some modifications to the existing legislation that allows human physicians to recommend it, to allow veterinarians to recommend it. Now, obviously, in the states that don't have medical marijuana laws on the books, that's a much harder piece to do. But for states that have medical marijuana laws, why not have them extend those benefits to our pets and allow the vets to do that?
If I want to know a little bit more information about if this is the right direction to go for helping my pet, what resources are out there for me?
There really aren't a lot of very pet-specific resources out there. And as I've said before, pets are not just little people. They have some very specific differences in metabolism and those sorts of things. So at this point in time, this is one reason why I've written this book and why I'm putting myself out there as an expert in this veterinary realm to be able to help the pet owner through the book I've written. I have a blog. We'll list all that information at the end of this that people can go to. They can ask questions and they can get answers. Other than that, I'm not so sure where they can find resources.
Thank you so much for giving the time to share this knowledge you have with us. We really appreciate it.
Thank you. It's my pleasure, and I hope this can help our pets because that's really what I'm here for.
Funding for PetX Talks is provided by Natura Pets. Natura Pets can help you optimize your pet's health with premium organic supplements from the Amazon and Andes Mountains. Visit naturapets.com. Dogwise Publishing. All things dog. For all of your expert dog book needs, visit dogwise.com. Found Animals. Working towards big ideas that advance the safety and happiness of animals in our homes, our shelters, and everywhere in between. Visit foundanimals.org. This has been a Pet World Media Group production.